But I am with Wood Services, as Kathy mentioned, and I'm sure all of you being Bucks County folks probably have heard of us at one point or another. But I've learned through conversations with the community that for years and years and under previous leadership, it was kind of ambiguous. How do I stop this from going? No one's really sure exactly what we do, so I wanted to give you just a quick snapshot of that. We do care for people with special needs. We have the campus in Langhorne where nearly 600 people of all ages with special needs live with us. The youngest person that we serve is 5 years old and the oldest is 87 years old. So really, when I say, we do wraparound care, meet all the needs of that population, we meet all the needs. We have schools on campus for our youth. We have vocational and job opportunities for our adults that are on campus, but also through our community partners. But beyond just the campus in Langhorne, Pennsylvania, we actually have affiliate companies and organizations. We have in-home supports, group homes. So across our whole spectrum, we serve about 18,000 people actually throughout southeastern Pennsylvania and New Jersey. And we have about 6,000 total employees. So just on the campus that you may be familiar with, we have about 2,000. And about 2/3 of our workforce, so 2/3 of those 6,000 people, are what we call direct service professionals, DSPs. So when Kathy and Tam mentioned this topic to me, caregiving and poverty, I thought that we could really provide an interesting perspective because we have these DSPs who are caregivers for a living, right, in addition to back home, their family responsibilities. And the direct service professional workforce is one that is experiencing a crisis, not just in Pennsylvania, but across the nation. And not just for intellectual disability, but people who are in similar fields supporting, elderly, long-term care, even child care. A lot of nursing facilities have a similar problem. And, so as nonprofit organizations, we're limited in what we're able to pay as wages because we're completely reliant on government reimbursements, whether, that's state funding, whether that's county funding, whether that's education. Is different for each client. But that's kind of why this workforce is a little strapped. It is a low-paying workforce. And I think on my next slide I have some statistics about their actual wages. But these are the type of people that we're serving through those workers who are really just meeting all kinds of needs. There's no typical day or typical job for a DSP. You may be doing housekeeping, medication administration, hygiene assistance, feeding. So really it's a demanding job. It's a job that folks love. They love to do it. They really connect personally with our clients, and I've got some pictures of that of our caregivers in action here as well. I love the mini horses. I missed it. I saw it on Facebook later that they were there that day. But there we go. All right, so here's what I'm talking about. Nationally, there is a workforce shortage. I do have some data just statewide for intellectual disability DSPs. The average wage is about $12.83 an hour. So if you're starting out, it's lower. It's $11.62. So obviously that's a concern. It's very, especially in a place like Bucks County, it's not a livable wage. So at Woods, we're trying to do what we can to support our workforce. We have healthcare incentives. We provide healthcare actually on campus. We have a medical center because we recognize that a lot of our staff is probably working 2 to 3 jobs already to make ends meet and can't prioritize their own healthcare. So that's one of the ways that we try to prioritize our workforce. We know not every provider is able to do things like that. We have education incentives, but we are just concerned, this workforce in general, the way that all those things that Kathy had on her slide, the circle around the person, I was jotting them down because I was like, yes, we want to see wage increases, we want to see better health care, we want all these things that our staff are worrying about, their child care costs, how are they going to make ends meet. So one of the things that I did just want to convey to you guys today, I think that it's important to make the connection between this workforce and how it's impacted by human services funding at the state, but also at the federal level, because one of the issues that we talk about a lot at the coalition is the need for a minimum wage increase, and we completely agree that that is needed, and we fully support it. But from the DSP perspective, we're just a little concerned that if the minimum wage is raised and human services funding is not also raised, that these are going to really quickly become minimum wage jobs. And I'm of the perspective that it's not a minimum wage job. It's very demanding, and something that takes a lot out of people. So if it becomes a lateral move, if you can make the same money being a cashier at Target or lifting an individual with disabilities in and out of their wheelchair and meeting their hygiene needs every day, we're concerned that the vacancies and the turnovers that we're already seeing in that workforce would only increase. So, again, completely support increasing the minimum wage, but also just want to make everyone aware that we could really use additional voices for the advocacy that we're already doing, and our partners and our associations that we work with are already doing to help, also raise wages for this workforce and for human services across the board. I did include one website that I'm aware of, fixtheDSPcrisis.com, and that is a advocacy effort of PAR and RCPA, some of these human services associations for Pennsylvania that you may or may not have heard of, but it's an effort where we're all joining together to try to raise the awareness of the need to increase human services funding as well, because really, people say, we need more funding for intellectual disability services. What does that mean? It goes almost directly to the wages, and is really important. Woods, I showed you that slide of all of the populations that we serve and how we're trying to meet everyone's wraparound needs and control the social determinants of health for all of our clients, and make sure that they're eating well, make sure that they're exercising well, make sure that they have someplace safe and secure to live. And we can control that because we're the provider and we're providing those services, but we have much less control over that when it comes to our workforce. So we're trying to do what we can to fix that and offer other opportunities, but we can always use more partners from the policy perspective to help us push some of those things that we think would be helpful. And I love any excuse to share more pictures from me. So we got our little guy there. I think that's the end of me. Yeah, so again, thank you for bearing with me this morning when I'm frazzled and just frantically caffeinated really quickly, so I'm even more frazzled. But looking forward to hearing from the other panelists and ways that we can continue to partner with each other and with the coalition to make sure that we have a pretty large workforce just in our organization, and we want to make sure that they're supported and that we're doing everything we can to see that happen. So thank you guys. Thank you.